Hello, my name is Carolina Garcia-Vidal. First of all, I would like to thank the organizers for inviting me to talk about this very interesting topic that is explained in a big picture, how artificial intelligence may help in the clinical decision making in infectious disease. This slide shows my disclosures. And when we talk about artificial intelligence, we talk about very different things, very different topics. From the more basic artificial intelligence tools, for example, those constructed by machine learning and neural networks, to the most complex artificial intelligence tools when we talk about generative artificial intelligence. There is a huge difference between generative artificial intelligence and predictive artificial intelligence. And in my mind, for the clinicians, it's important to know that with generative artificial intelligence, we can create new content, but also it's super difficult for all of us create small programs or small, artificial intelligence programs to help our institutions or whatever, in contrast, predictive artificial intelligence is more related with better mathematical tools to improve the results of our research. And I think it's something that any particular researcher may use in the clinical setting every day. So I'm not going to talk a lot about generative artificial intelligence. Probably you all are used to work with ChatGPT, the best assistant that you can have. But also you may find nowadays another generative artificial tools who are amazing for all of us. For example, Gamma to create slides and to create presentations, notebook to summarize different papers and patients of data in a very easy way, even also Open Evidence, who works in a very similar way, or Heidi, that you can talk with your patient, and the generative artificial intelligence is creating all the notes that you need for the clinical, for the health records in your hospital. All of them are amazing. I invite you to test all of them. But it's true that from my point of view, it's difficult that you as only physician, may perform something similar than this. I'm going to create this tool to help physicians. So generative artificial intelligence tools are super expensive, need a lot of complexity in programmation. So it's something that we can play with that, but probably we cannot really work with that in a huge more than a users. Artificial intelligence can be used in any different moment for drug development, also in all the moments that we want for diagnostics. I really recommend this review in the Lancet Infectious Disease, who summarized a lot of different points in which artificial intelligence may help or clinical diagnostic. But what I really want to share with you, and I think it's an obligation for all of us, is understanding what is predictive artificial intelligence and how our teams or research teams needs to adapt these predictive tools to improve the clinical research. I don't know if you're aware about what predictive artificial intelligence is, And let me ask you one question, If you want to meet with me in Barcelona next summer, how you imagine this meeting, Are you imagining that we are going to be very cold in the snow, or we are going to be in the beach with a hot weather? No, you all think that Barcelona in August 15 is going to be very hot, And this is because you have superpowers? No, this is because we have a pattern of temperatures who are always equal, and we are able to identify this pattern. So this is artificial intelligence. Predictive artificial intelligence. We are going to look for patterns that allow us to say what is going to happen with our patients. For using our predictive artificial intelligence, we need to divide these four steps. The first one and the most difficult one is to achieve the data. We have a lot of data from medical records, a lot of data in the electronic health records in each hospital, but the problem is that this data is in a very different tool. Sometimes the data is in a structured way, sometimes is with PDF, and you need to read this data and after structure it. So the first thing that you really need to do is put all this data in order. No, and this work has been amazing in my hospital, and we spend 5 years to put this data in this MySQL system, no? And from here, I can pick all the data that I want, and I can work with a very high number of data. The first thing when we retrieve data from electronic health records is to check how the quality of this data is. I remember the first time that we retrieved data, we have patients with more than 100 years old, or patients who die, and after that were visited in my consoles. No, so this is something that it's not true. No, so we identified these 9 different points to check the quality of data. And if someone talks with you about artificial intelligence and do not spend sometimes to explain you that how important is the quality of the data that you are going to work with, don't believe anything, no? Because if you have no good data, you are not going to have very good results, no? And for example, these both journals are well known for all of you. New England Journal of Medicine, also Lancet, the Lancet journal, no? And they had to retract different papers in the COVID era because nobody checks the quality of data, and so all the things that they finally published were false data. To work with this high quality quantity of data, we need to use two different programs. For example, we can use R, or we can use Python. If you are used to work with SPS or Stata or all these programs, let me say that this is the old way to do mathematical models for patients. No, now we need to introduce these new tools to work with all this data. No. And when we have all this data, we can go further away to the next step. And the next step is how create models to predict what is going to happen with our patients. For that, it's super important to understand why artificial intelligence tools are much better than those mathematical tools that we were using to work with in the past. No, I remember one of the first times that I worked with people works in computers. No, that they told me, Carol, now you're very happy because you are going to work in a multidimensional world. No. Well, yes, my excitement was exactly similar than your excitement, but this is one of the most important sentences that someone told me when we are talking about artificial intelligence. All the research in medicine is based in regressions models mainly. No, and regressions models means that I put all the data that I have of my patients in a two-dimensional superface, you know. And as you can see here, no, 1, 2 dimensionals, and I draw one line. All the things above is yes, all the things below are no. No, but if we think one of these points what really means, no, we are going to understand that probably we are living in a very multidimensional problems. No, for example, if I ask into my mathematical model which one are the factors related with, for example, multi-drug resistance bacteria. No, probably you all are going to be agree with me that the antibiotics use, the multi-drug environment, and the microbiota status are close related with this problem. No, that means 3 dimensions. I don't know if you are aware that the human mind only can work in 3 dimensions. So that means if I told you I have a lot of antibiotic use, no? So this line is super powerful. You can imagine how this ball is going to go, no? Because your mind in 3 dimensions works very well. But if the problem is not in 3 dimensions, in the the problem has a multidimensional statement, it's super difficult. If I told you antibiotics use is super high, no, but also clinical severity is medium and number of rooms is very low. And in this, the team experience is super important, no? Where the ball is going to go now, no? It's something impossible for the human brain, almost in a good accuracy, no? But this is how artificial intelligence models works, no? In a multidimensional space, we are doing these predictions. There are two different types, and it's very important to understand these problems, no? One is these tools. One is supervised learning. That means that I have a problem and I talk with the computer and I say, this is the answer. And the other is unsupervised learning. That means that the computer learns by himself. Let's put some examples. For example, this is an unsupervised artificial intelligence model. We have here a lot of patients. Probably it's easy to understand that this is COVID patients, no? But probably the patients on the top, on the left, are quite different than the patients on the bottom and right, no? This is something relatively easy to understand, no? But the computer is able to do this distinction in a very objective way, shooting different points that the computer calls centromers. And we have different mathematical models to know how many centromers we need to shoot. No, the computer relates all the points that are closer to this centromer. No, and when they assign these points, put the point in the centromer in the center again, and do this process again, and at the end, the computer is able to say, I have 5, 6, 7 different groups, and these patients are super similar between them and more different with the other than all the other patients. For example, no, this is one example that we use unsupervised artificial intelligence in COVID patients. As you can see here, the computer divides those patients in 5 different subsets. As you can see, no, the pink are quite different than those patients in the yellow. And as you can see here, the computer say, and most deaths are focused in this area, no, especially in the yellow area, no, the points are deaths, and the purples are accumulations or patients who dead, no. And as you can see here, one computer without knowing about COVID-19 was able to divide the patients in 5 different clusters who have a mortality ranging from 2 to close than 30%. And the most important is that when we analyze the use of antivirals in this high-risk population with a 30% of mortality, we see that the use of one antiviral or not was related with 4 times increased risk of mortality. We validate these results in an external cohort validation with a very similar results. We also use non-supervised models. This is a Camida models that we were able to incorporate not only continuous variables, also dichotomic variables. And as you can see here, we were able to differentiate 3 different clusters of patients with a risk of having bloodstream infection ranging from 4% to 40%. No? This is a study including only neutropenic patients. And as you can see here, we also validated an external cohort with the same results. So, of course, the empirical treatment that we need to use in this patient should be super different. And moreover, all those patients who really have more resistant bacteria were identified in the same group. And here, no, using something similar than NotRadio, we were able to open, no, to see exactly which one were the variables and the value of these variables to create all these algorithms. The difference with supervised artificial intelligence is that in supervised, this is an example with a 3-dimension model because we need to understand with our human brains, no? And as you can see here, we have a lot of points, no? So we can teach our computer these patients have this problem and the other patients have not. If we are using the most usual patients for doing that, if after that I want to say, and these patients are more different, no, are more in the periphery, but this patient yes, this patient now, and this patient yes, this patient now. This is how neuronal networks may work. So when I have a new patient, the computer makes all the connections and is able to say the probability with this topic is yes, this probability with this topic is no. For example, in this study, we compared to do a regression model with an unsupervised algorithm, with a supervised algorithm to answer the same question. My patient with hematological malignancies, when he comes to emergency department, which one is the risk of having a bloodstream infection? And as you can see here, our models were improving from the less, the poorest results in the regression model to the best results in the supervised artificial intelligence models. In this study, using also supervising artificial intelligence, we were able to predict with 80% of accuracy which patients at the onset of the fever are going to have a multi-drug resistant infections, or for example, in this specific study, using neuronal networks, we were able to decide exactly these patients which is the expected mortality if we use this antiviral or not, these patients with COVID. So as you can imagine, the powerful of these predictions are especially much higher compared with all the other predictions that we have done before. So now we are working in more process in fungal infections. We have a lot of reviews talking the news more important of this, but the most important thing is to remember that what we are talking is about better mathematical models. And to finish, all these models need computer tools to be interactive with them. This is one of our computer tools that was a COVID center control. And here we have in real time the different patterns of patients with COVID, and this program was awarded by the Ethical Award in 2020. And this is the most important book of infectious disease in Spain. And here we have also 2 artificial intelligence models to predict bacteremia in patients with febrile neutropenia, and also bacteremia in patients who arrive to emergency department. So artificial intelligence is something that we are not talking about the future, it's already here, and will play a key role in personalization, in the personalization of treatment. Predictive artificial intelligence is something that we need to incorporate to our research, because the best way to create mathematical models to answer some questions. So with that, I'm going to finish, and now we are open for questions. So thank you very much for your attention.